Hello, everybody. Nice to see you today. We're starting a little bit later than yesterday, so I hope that you had a time to rest after yesterday's program and dinner. Today, we are going to talk about interesting topics, and our first topic is fat, inflammation, and joint pain, the role of obesity in RMDs. And the speaker is Dr. Valentini Constantinidou. She is a nutritionist, and also she is a dietitian, and she is the founder of DNA Nutri Coach. The floor is yours.
Thank you very much. Here, great. Good morning, everyone. Thank you for being here today. I would like to thank also the organizers for the kind invitation they gave me to be here with you and explain a little bit about the role of obesity in RMDs, especially focusing on fat, inflammation, and joint pain. For the ones who would like to know a little bit more about my research and my background, I invite you all to scan this QR code to see what I have been doing the last 20 years in nutritional research and specialized in genetic predisposition. So, for the next 20 minutes or so, I would like to summarize in 3 main points. First of all, to be able to understand the link between obesity and RMD, to understand what kind of link is common. So we can actually move to nutritional therapy that will treat inflammation. And I would like to end by giving you some practical, everyday solutions that everyone can actually start implementing from today. Obesity is not a condition of losing 2 or 3 kilos, 5 kilos. Obesity is a disease. And it's a disease, a multifactorial, multigenetic, that affects all kinds of different stages in our lifespan, both in male and females, and in different areas with different severity. The roots of obesity, until very, very recently, lots of people were thinking that it's genetic, so it runs to my family, and I can do nothing about it. It is what it is. Well, we have the science and we have the data to prove that this is not the case, that although there is genetic predisposition to obesity, there are lots of things that we can actually do to reverse, to handle, and to control it. I'm talking about personalized nutrition, precision nutrition, that can actually have given us the tools to be able to treat each person depending on their genetic profile. This is the latest that we today know, and we can actually apply in clinical practice if we want to treat obesity better than before. Concerning the mechanisms that we are interested today of how obesity actually influences musculoskeletal, rheumatoid diseases, I'm focusing in those 4, although there are a lot of more, but these 4 main mechanisms are the ones that I want you to remember. First of all, of course, is the weight. A body that weighs more has more problems in their skeletal, in their muscles, in their mobility. However, besides the obvious, which is the weight, there are 3 other mechanisms, which is the gut microbiome, the brain, and the adipose tissue, that we can act in a molecular level. And they actually function in a molecular level and produce the response, produce the signal, the symptom that one may have. What do microbiomes do in the body? A lot of things, and we do co-living with a lot of microorganisms. In fact, what is the most important from all their actions is that they actually develop a mature immune system. They help us function better because they help us protect better through our immunological system. This is what our microbiome all over our body is actually doing with great, great power. there is a number that I always remember that is about 1,000 more genes, 100,000 more genes that our microbiomes, our microorganisms have than our own genes. I mean, human body has already about 30,000 approximately, we may say. Well, our microorganisms that they co-live with us in our body, they have like 100 and maybe more thousand. So one thing is that. And what are interesting, especially in terms of obesity, are those three pathways that connect our gut microbiome with brain. The famous gut-brain axis, if you have heard it. There is a bidirectional communication, and there are three main pathways that they interfere and they are affected both ways. The nerves, of course, that start from the brain, ends to the gut, and vice versa. All the hormones and all the neurotransmitters that they are secreted, both ways also. And of course, our immune system through the messengers, all kind of messengers, all kind of molecules that affect our immune system. The third and final mechanism is the adipose tissue, which is not the same when we have a lean body and an obese body. When we have a lean body, as we can see here, the adipose tissue acts as a totally independent, different organ. It produces anti-inflammatory molecules, and it helps us reduce the pro-inflammatory molecules. This is not the case when the adipose tissue becomes obese. And this is not the case because when it becomes obese, it gets inflated. It gets inflamed, I'm sorry. So all this production getting reversed. Instead of having anti-inflammatory molecules, these molecules are going down. Instead of lowering the pro-inflammatory molecules, these pro-inflammatory molecules are going up. So the mere situation of changing from lean to obese, our adipose tissue is able enough to reverse its function. We know that all the molecules that we can find in a lean adipose tissue has nothing to do in terms of the content and in terms of the function between lean and obese. Here we can see that there are a lot of interleukins, tumor necrosis factor alpha, interferon gamma, and a lot of more others inflammatory markers that they are basically taking over the place in an obese adipose tissue, while in a lean adipose tissue, it's not. So yes, obesity can induce type 1 immunity, as we can see here from the different photos of a lean and an obese adipose tissue. And all this adipocyte necrosis and all the activation and all the antigens that they are produced, in fact, they help the inflammation get going. And this is why sometimes in RMDs, the medication that we give, it doesn't work because there is ongoing inflammation underneath that inhibits all the factors that we give as molecules, as therapeutic drugs, and it doesn't work. I'm talking about these molecules because they are the same molecules that they are involved in pain signaling and in pain sensitization. When we want to treat pain, for example, here in a bone, we need to treat all these same molecules that they are produced from our immune cells, and these are the same that they are also produced from the adipose tissue that has been inflamed. So inflammation is the key procedure that combines obesity and pain. And there are a lot of prospective studies in adults the last 10 or more years that actually shows that if we are able to trigger and to measure inflammatory markers, this may have a predictive value for a lot of chronic diseases, cardiovascular, neurodegenerative, musculoskeletal, etc. And this is where nutritional therapy comes in place. For the ones that they are not yet convinced that nutrition quality and dietary quality and not quantity necessarily can actually help reverse a lot of conditions. Here is a recent article from 2017 in the New England Journal of Medicine showing the reduction in all-cause mortality after 12 years of follow-up between 1998 and 2010, only when we were able actually to improve diet quality. And quality is measured in a molecular level, in the nutrients that we are taking or we are not taking. Today, the nutritional therapy is far beyond grammars and calories. Today, nutritional therapy is 100% precise and personalized, and we have data and we have tools to actually be able to measure microbiota, genes, metabolomics, deep phenotyping for each condition, patterns, behaviors, physical activity, and to personalize and to give more precise direction and nutritional recommendations. The first one, and I'm going to present you the more famous and productive nutrients that we are actually using. First of all, are antioxidants. And when we are talking about antioxidants, it's not only vitamin C. There are polyphenols in olive oil, there are vitamin E, there are different kinds of fiber that they all help reverse these inflammatory molecules, treat inflammation from inside, from the bottom, from the root that they are actually generated. So number one that we have, in fact, we can measure CRP, interleukin-6, a tumor necrosis factor alpha in systemic blood, and we can see differences after treatment with specific antioxidants. The same we can also see with fiber and systemic inflammation. This is a recent study that have shown that the more a person consumed fiber, the more, meaning up to 30 grams per day, and in a longer condition, for example, up to 1 year or more, the higher the dose and the duration, there was a direct association with lower CRP levels in systemic blood, relative to the control groups that they have not increased their fiber at that levels. Back in 2010, we were the first group to actually show that extra virgin olive oil with their phenolic compounds was able to lower the gene expression changes in gene related with inflammation. For example, I show here the interferon gamma, the interleukin-7R, among others. This study was in healthy individuals during 3 months of continuous and systematic extra virgin olive consumption in the terms of Mediterranean diet, and we were able to see the results in both groups versus the control. It's very important that the control was a low-fat diet, which is generally a recommendation that until now lots of people have been taking and following with the aim of losing weight, because we don't want to eat fat, so we want to lose weight. It's not the case. In 2011, EFSA, European Food Safety Authority, based on those results and others, of course, released a health claim about the oxidation of LDL if we consume up to 5 micrograms of hydroxytyrosol, which is the main compound, phenolic compound that we have in extra virgin olive oil, not in other kind of oils, extra virgin olive oil only. And of course, until now, I have shown you molecules and I have shown you ingredients, but we do not eat ingredients, we eat dietary patterns. And the only dietary pattern that actually have proven anti-inflammatory action is the traditional Mediterranean diet. The traditional Mediterranean diet, which is unfortunately not very familiar. A lot of people, although we live in Greece and in other Mediterranean countries, they believe that they are following, but they do not. The adherence in the traditional Mediterranean diet can be measured. There are validated questionnaires, and we can actually help people adhere more and up to the highest level. This is the pyramid, the updated pyramid that was released in 2020. And I want you to focus in the base of the pyramid, which is not food. The base of the Mediterranean diet pyramid, it's not food, it's lifestyle. And this is part of the treatment. We cannot treat obesity, we cannot treat pain only by molecules. We need to treat them by lifestyle. And by saying lifestyle means moving, resting, socializing, cooking, traveling, enjoying. This is the base of the Mediterranean diet pyramid that has been recently updated. Of course, we have data, and this is the Predimed study that we have performed the last almost 20 years in Spain, about the immunomodulatory effect of a Mediterranean diet in adults. Especially these results are for people who are at high risk for cardiovascular disease. But I want you to remember that all these complex diseases, cardiovascular, musculoskeletal, neurodegenerative, they have the same baseline molecular root, which is inflammation. And oxidative stress, but inflammation is the first one. Having all this information and having all this data and research data the last 20 years or so, and there is still conflicting information out there that cause confusion. This slide was presented in 2020 in Tufts University by Professor Jose Maria Ordovás, showing a huge study and a huge statistical analysis that almost 80% of people arguing that there is a conflicting information about what food I should eat or I should avoid for my condition. And also that the conflicting information about what I should be eating makes me doubt the choice I make. And if I doubt also the science. And if I'm confused, I do not believe and I do whatever I like. And this is something that until now, this was presented in 2020, it's still happening. And we would like to change that. I would like to end with some practical everyday solutions. I invite you to take notes and to make like a handbook of do's and don'ts. I will start with the do's, and I will start with the adhere to the traditional Mediterranean diet. If you are not sure how, ask. We have the questionnaire. We can help people adhere to the traditional Mediterranean diet 100%. Increase fish and seafood in all kind, and substitute the majority of the consumption from red meat. Increase B6 levels from green leaf vegetables. Choose whole foods and not processed foods. Processed foods is a huge different chapter. We can actually talk for hours. There are a lot of kind of processment that we can find in a supermarket or any kind of market. And people need to understand how to distinguish which one is more processed, less processed, can I, may not, and the frequency of the consumption of this processed food. Also, please do personalized supplementation. There are people that are coming with a bag full of supplementation, and the effect is minimal or very, very zero. And that's why it's happening, because the supplementation, the huge amount of supplementation is not for everyone. We need to personalize which ones will give us the effect that we are waiting for. Of course, I'm going to tell you do's about the lifestyle, not only about eating. And I will start with physical activity or exercise. Depending on each body, it's how it is present, how it is actually doing. But the key is to start small, to start one step at a time, and get improving. The level of improvement depends on each body, and this is okay. But we need to make our patients move. take care of their sleep. If we have a problem with their sleep, ask for help. If our brain cannot restart and reset during sleep, these byproducts, products that they are producing, will enhance inflammation, will continue in our in our system. And this will make any kind of treatment even worse. Assess emotional eating. There are a lot of people who eat emotionally. Yes, we know it. There are protocols now, there are questionnaires, there are ways that we can actually help people address emotional eating and not use it as an excuse that I cannot change. No, you can change if you find the right way and the right path and the right guidance. Assess work-life balance if necessary, psychological stress or any kind of stress with a psychotherapy or a mental health specialist, and improve your skills, any kind of skills. When our brain starts learning something, this enhances growth of hormones, growth of anti-inflammatory molecules in pathways that act in parallel. They are not act directly, but they act in parallel, and we want that. Because complex diseases need complex solutions. I'm going to finish with the don'ts. So please don't take only pills. Please put them inside a dietary pattern. Please put them inside a traditional Mediterranean diet. And please substitute all fat, raw, cooked, used in any kind of ways, with extra virgin olive oil. The recommendation is about 4 tablespoons per day. It's not too much if it's well organized in a dietary advice, depending on each person. And if it's adjusted, it gets adjusted with a physical activity. So please put all the any kind of supplementation that anyone can have inside the dietary pattern. Even if I take the best supplements, and I'm not eating the right food, I limit the effect that I might have. Last but not least, please decrease caffeine, alcohol, smoking, and all kinds of addictions. Processed food, I mentioned before, there are levels of processed food. There are the ultra-processed, there are the minimally processed. We need to help clients and people in general to understand how to distinguish them and the frequency that they can actually consume them. And of course, treat the sedentary behavior whenever is possible. Even one step at a time is enough to reverse the molecular mechanisms that they have been like dying underneath when we are not moving. The things that we are going to choose today, they are make our lives better or worse tomorrow. Thank you very much for your attention. I will be glad to take any questions.
Sorry, I do have a question.
Okay.
Yes, of course.
To me, all these steps look amazing, and I think as Mediterraneans, we're all trying to, follow them to improve our quality of life. But a lot of people, including me, are struggling with stress and work-life balance. Do you think that following all the previous steps in terms of nutrition, exercise and stuff, will be able to, let's say, cover these two, or like the vice versa?
The stress, you mean, that's produced from the work life?
Exactly.
Yes. Definitely, there is another mechanism working for that. But I'm going to go back to the pyramid. It's not a coincidence that the base is lifestyle. Because when I move, when I rest, when I socialize, when I take care of my food by cooking, I lower the stress levels in my body. And this affects the bioavailability of all the rest of the molecules that I'm going to ingest. So if the base is things that I'm doing, I'm putting the base for all the things that I'm intaking afterwards to work properly and to function. So yes, Mediterranean diet, it's not just a diet, it's a lifestyle and can help me alleviating a little bit this kind of everyday stress that we tend to have a lot. Of course, this may not work by itself in a lot of cases. Okay, that's why we need a therapist. That's why sometimes we need also drugs, which is okay. But even if we take medication, if we do not have in parallel the correct nutrition, the feeding will not work, will not have the effect that we are expecting. It's like putting an enhancer. It's like helping the drug do its function better. So yes, you're welcome.
Thank you, Dr. Constantinidou. Are there any other questions? Yes.
Well, I want to refer a little bit on to the emotional eating you've mentioned, because I think there is a high probability that everyone in the room might know what this is about. And the emotional eating, when it comes to the medications we receive, because there is a link, I think. I don't want to say I know, but I do know that. But I just want to say I think. There is a link between the medication, the side effects. Sometimes it's nausea, upset stomach, or whatever is happening there with the side effects. And then there is the whole situation of us being in the whole turmoil of the disease itself. So the disease is, and the comorbidities of us being sometimes depressed, anxious, and the whole mental health issue. So the emotional eating is in the midst of all of that. So it's I think what you've just presented is amazing, and its core concept, I'm totally agreeing, while I'm kind of feeling that it's not always easy, even trained in the concept. It's not easy to do it every day when emotional eating takes a very live and actual being in your existence. So what is your thoughts on that, please?
First of all, thank you. It's a very nice point. First of all, emotional eating pre-exists. It doesn't come after. So we have a tendency. So the first thing is for the person to realize that the person has a tendency. And the emotional eating generally based on the consumption of satiety and hunger. People who eat emotionally, they do not have this switch. Generally, they do not understand I'm full, and they do not understand I'm hungry. They eat by their clock. They eat because something smells. They eat because everybody eats. So this pattern is a dietary pattern. So no, it's not easy, definitely, because we have grown up learning to eat like that. So the first thing with the therapy and the nutritional therapy is to reverse it, to understand it, first of all, to see the pattern that I'm doing, and to start improving it. It will be like 6 months therapy. I have no idea. I have people that I treat them for 6 months and they are perfect, and I've been treating them for 4 years and they are still need help. So depending on the condition. But generally, emotional eating pre-exists. Now, if we add medication, if we add disease, if we add conditions that are actually not helping us towards the same direction, but they're going like opposite, yes, it will be harder. That doesn't mean that cannot be improved. Because if I realize the pattern that I'm eating emotionally and I start improving, not 100%, but 50%, there will be an improvement. And I want this improvement because it will be translated in improvement in my symptoms, in improvement in my quality of life, in the frequency that I have maybe some extra peaks in my condition. And this is something that can be built. It's not working, the treatment of the, not the treatment, the change of this dietary pattern, the emotional eating, it's not working like a drug, like a medication. It's working like a habit. I'm changing my habit. I have learned to eat emotionally. And now I'm unlearning it. And it goes in parallel. I don't know if. Okay. Thank you. Yes.
You spoke, you spoke about fiber. That while adding fiber, you should add liquid also. It's very important to have a fiber and water. You didn't mention it.
No, because for us, like nutritionists, it's obvious we cannot eat fiber by itself. We need to boil the legumes. We need to melt them with water, and water with moving and with fiber are the three conditions that help our gut. So it's like I didn't mention it. There is always in the studies. It's like default for us. That's why. But of course, you are right. There's always water in that. You cannot eat fiber by itself. Thank you. Okay. Yes, of course.
Okay.
Oh, here.
Okay. Thank you. Okay. I would like to give you a present and thank you for this interesting presentation. It was very useful and helpful for all of us.
Thank you very much.
Now we are moving to our workshops. Those that have chosen the workshop, which is living with multiple autoimmune conditions, led by Dr. Mini Day and Andri, will be going to the next room. So these are Ram, Eva, Claudia Gomez, Velikrit, Jelena, Ingrid, Marinela Rizzo, Mahi, Ivanka, and Merivela. So you go to the next.
Before going and split, please, those who did not vote for the best practices, please vote for the best practices because it's a pity to have only 6 votes. We cannot have the first, the second, the third prize with 6 votes after 12. Thank you.
Yeah, thank you. So the others, we are staying here.